Thank you for taking the time. As indicated in this slide, the information being provided in this presentation is general in nature. There are exceptions and special circumstances that may affect how this information may apply to you. When selecting Medicare plans, it is very important that you consider your own personal situation and make choices that are good for you. A counselor can help you navigate through the various Medicare options that are best for you. Please note that the information presented in this video is current as of the year shown. This slide shows an overview of the various parts of Medicare and the options you have in choosing how you want to obtain Medicare insurance. In general, there are two paths you can take to obtain Medicare insurance: Original Medicare on the left or Medicare Advantage on the right. The differences in the two paths will be covered in other videos. The key parts of Medicare are Part A, hospital coverage; Part B, medical coverage; Part C, Medicare Advantage; Part D, Medicare prescription coverage; and Medigap, or Medicare supplemental coverage. This video covers Medicare Part D, prescription coverage. Medicare Part D is also referred to as a Medicare prescription drug plan. There are many plans available, and the specific plans depend on the state in which you live. For example, this year there are 28 different Part D plans available in North Carolina. The requirement to have a prescription drug plan can be met in one of three ways. First, you can enroll directly in a Medicare prescription drug plan. This is often referred to as a standalone plan. Adding a Medicare prescription drug plan adds coverage to Original Medicare. As an alternative, you can enroll in a Medicare Advantage plan that includes drug coverage. Often you will see this type of plan referred to as a MAPD plan, which provides hospital and medical insurance as well as prescription drug insurance. The third way of meeting the requirement for a prescription drug plan is to have creditable coverage provided by one of the following: an employer plan, the VA, military or federal benefits, or other creditable coverage such as some job-based or retiree plans. Note that for coverage to be considered creditable, it must, on average, pay as good or better than the basic Part B benefit. Medicare Part D is available for anyone with either Medicare Part A or Part B. It is optional. However, if you don't join when eligible, you may have to pay a lifetime monthly penalty. Now let's talk about the costs associated with Part D insurance. Monthly premiums for standalone Part D plans vary. This year, the monthly premiums ranged from about $13 a month to $121 a month. You may also have to pay an income adjustment if you earn above a certain amount. Deductibles also vary by plan. Medicare allows a plan to charge up to the maximum deductible as shown. Deductibles can vary by plan from zero to the maximum. In some plans, deductibles apply to only certain tiers of drugs. Be careful not to choose a plan based only on a deductible. Instead, look at the total cost of the plan for premiums, deductibles, and cost of medication. Part D plans also typically require co-payments and co-insurance. As with premiums, co-pays and co-insurance vary based on the insurance company and the plan you choose. Many companies offer more than one plan, as well as the medications you are taking and the pharmacies where the medications are purchased. As mentioned previously, Part D plans may charge an annual deductible of up to the amount shown. After you have paid your deductible, and before the retail cost of the drugs reach $4,020, your Part D plan will pay about 75% of the retail cost, and you will pay about 25% of the retail cost. This is called the initial coverage stage. During the deductible period, some generic drugs are low cost or $0 per month. Brand name drugs will be full cost until the deductible is met. Once the retail cost reaches $4,020, you will pay 25% of the cost of the drugs until your out-of-pocket expenses reach $6,350. This is called the coverage gap. You may also hear it referred to as the donut hole. While you are in the coverage gap, your out-of-pocket expenses are determined by what you pay plus the portion of what the manufacturer pays. Your out-of-pocket expenses include the yearly deductible, co-insurance, co-payments, what you paid in the coverage gap, and what the manufacturer paid. Together, you pay about 95% of the cost of drugs. Once you have out-of-pocket costs that reach $6,350, you enter the catastrophic stage. In this stage, the costs are paid as follows. The Part D plan pays 15%, Medicare pays 80%, and you pay 5%. You can enroll in a Medicare Part D plan during your 7-month initial enrollment period, which includes the 3 months before your 65th birthday month, during your 65th birthday month, or 3 months after your birthday month. You can also enroll in a Part D plan during the yearly open enrollment period, which runs from October 15th through December 7th each year. Additionally, you can enroll during the Medicare Advantage open enrollment period, which runs from January 1st through March 31st each year. During this period, you can enroll in a Medicare Advantage plan that includes drug benefits. Here are some important points to consider when deciding on a Medicare Part D plan. Check to see what kind of drug coverage you might receive from your employer, the federal government, the military, the VA, or any other source. Find out if the coverage you have qualifies as credible coverage. Determine if you can or should also have a Part D plan. Decide if you plan on using Original Medicare or Medicare Advantage, or are you not sure? Make a list of all your prescription drugs and dosages. You will need this information to determine the best plan for you. Drug companies are required to cover at least 2 drugs in every category, but not all drugs in every category. This is called their formulary, the list of drugs they cover. If you want general information, go to Medicare.gov, click on Find Plans, and continue without logging in. Or, for more access to much of your Medicare information, log in or create an account at Medicare.gov. At Medicare.gov, you can type in your list of drugs to get the cost that each drug plan or Medicare Advantage plan will charge. You will need the name of your drug and your dosage. Medicare.gov provides a list that compares the total cost, premiums plus drugs, of all plans. You can also contact SHIP at Senior Pharmacist for assistance with plan selection at 919-688-4772. A certified counselor will help you navigate the Medicare system so you make the best choice for you. Once you have decided on a drug plan, you can enroll in one of 3 ways. Online at the Medicare.gov website, the counselor at Senior Pharmacist can help you with this. Or by calling Medicare at 1-800-633-4227. Or by calling the drug company directly. Please take note of the following very important information. Drug companies' formularies, the list of drugs they cover, change every year. You should check your drug coverage every year during open enrollment from October 15th through December 7th to avoid overpaying the following year. There are many sources available to help you understand Medicare Part D and navigate the Medicare system. To set up a free appointment with a SHIP counselor, call Senior Pharmacist at 919-688-4772. To learn more about Senior Pharmacist and get access to additional videos and other material, visit their website at www.seniorpharmacist.org. You can also call the North Carolina SHIP office at 1-800-408-1212 to speak to a SHIP counselor. You can visit the North Carolina SHIP website at the link shown on this slide. You can also visit the Medicare website at www.medicare.gov for more information. For more information on other parts of the Medicare system, please check out these other videos on the Senior Pharmacist website at www.seniorpharmacist.org. I hope you have found this video helpful. Please check out the others. Thank you for watching.